Dog, you're sleeping?
Yeah.
By the way, how are you doing?
I'm doing good. How are you doing?
I'm okay, thank you. Looks like you are tired.
Yeah. It's tiresome.
I have another question for you today.
Okay.
Yes. Dog, what causes diabetes?
Oh, diabetes.
Yes.
Okay. You want to understand what is diabetes in short? Everything about diabetes. Okay. Ah, let's dig in a bit. So, from a perspective point of view, and others as well. Okay. So I will start first by defining what is diabetes mellitus and also the types and how they can be managed. Most especially, we know that type 2 is it can be managed as well. You know that?
Sure.
Yeah. Okay. Basically, diabetes mellitus is just an abnormal metabolism um, that leads to high glucose in blood or hyperglycemia to say so, and this is due to lack of endogenous insulin
Yes.
and also insensitivities to insulin receptors. Okay, so
Sure.
that is basically the diabetes. So diabetes, there are about 3-4 types of diabetes. We have diabetes type 1, you have diabetes type 2, you have diabetes type 3, which is called gestational diabetes or pregnancy-induced diabetes. Okay, and the other one is the one which they call miscellaneously. Okay,
Okay.
yeah. So we jump into diabetes type 1 since you want to understand the whole chapter about diabetes, right?
Sure, I may proceed.
Yes. So, um, in diabetes type 1, initially it's the distractions of it's an autoimmune system or it's an autoimmune infection which leads to the destruction of the beta cells in the islets of Langerhans in the pancreas. So specifically, the pancreas is responsible to produce enzymes and hormones that are responsible for also normal body metabolism as well. So specifically on the pancreas, I'm going to talk about the cells that produces these hormones that regulate glucose. Okay.
Okay.
We have insulin and glucagon. Insulin specifically is produced from the beta cells of the pancreas. So what normally happens in diabetes type 1 is that those beta cells that produces insulin, they are being distracted. So it's an autoimmune infection. Okay. So the risk factors for that is you find that most risk factors are Hashimoto's disease. Yeah, I'm sure you know about that.
Yes.
Hashimoto's, also uh, Cushing's syndrome. Okay. Yeah, and also there are some viruses such as like Coxiella and also Rubella. They can also lead to that. Okay, but the most cardinal ones, they are the autoimmune ones. The Hashimoto's. Okay. So what happens there? So they'll block the release of insulin. So once the insulin is not produced, it is going to lead to accumulation of glucose into the bloodstreams. And we know the function of insulin is just to facilitate the uptake of glucose into the blood cells. So in short, in blood we have a lot of glucose, but in the cells, in the actual sense, in the cells we don't have glucose, and we need that glucose for normal metabolism for you to function. Okay.
Yes.
So in diabetes type 1, the major symptoms that they normally see there is that you find that someone is passing urine more often or polyuria in simpler terms to your level actually. Yeah. So now, why do they pass urine more often? It's because of the glucose. It has been accumulated. It's accumulating in the blood streams, um, in the blood. Okay.
Yes.
So what will happen there is that glucose is not being it's not entering into the blood cells. What will happen is that the kidneys will try by all means to excrete that excess glucose because we don't want much of it, much of glucose into the blood.
Yeah.
Okay, so the kidney will try by all means, and where glucose also goes, it attracts a lot of water as well.
Yes.
Yes. So as they are passing that, they're also becoming dehydrated. So they'll be losing water. They'll become weak and dehydrated. They won't have water. They'll be feeling thirsty and so forth. Okay, that is diabetes type 1. And diabetes type 2, fast forward, it's that one is a resistance to insulin receptors. Insulin can be produced by the beta cells, but you find that the receptors that are responsible for those insulin to be taken up into the body cells, they are not working as they're supposed to be. You find that the 3 receptors are the ones that are only working, and these other 3 or 4, they are not working. So as a result, you find that insulin will be accumulating in the what? In the blood streams. Okay?
Yes.
In the blood, or it just be produced, but it won't be. It will just. You find that a small amount of glucose is one which is now going into the blood cells. Okay.
Yes.
So now, what will happen there is that the patient as well also complain of the same issue as the diabetes type 1 patient, but not that much. Okay.
Yes.
And this patient will appear more obese because of the insulin, the effect of insulin when it is accumulating more in the blood, it tends to cause lipogenesis. Lipogenesis is more like the buildup of lipids into the bloodstream. So these people appear obese. And diabetes type 1, they appear thin.
Okay.
What do I mean? They appear slim because the body tissues, they are trying by all means to break those fatty adipose tissues in order to make glucose, and also they use other alternatives such as that is the major one, breaking adipose tissues to make glucose, to compensate for the glucose which is not there. Okay, that's the reason why they appear more slim. Okay. And gestation diabetes, this one mostly it's in those pregnant mothers. Okay.
Yeah.
It's due to the syncytial trophoblast now that produces this what we call the human placental lactogen. They're the ones that also leads to inactivation of insulin receptors for insulin to bind to those receptors so that we have glucose into the body. So they produce that and make those cells inactive, receptors inactive. And also the last one, I'm talk about miscellaneous. So this miscellaneously are more like we call them idiopathic. Mostly, some of them we call them idiopathic. Some they are caused by drugs. These drugs that we normally take for treatment of. Or let me just give an example of thyroidism. Yeah, in thyroidism we have hyper and hypo.
Yes.
So if you take off, you are not regulating the intake of those drugs for managing that, you might find yourself triggering yourself into diabetes. Okay.
Yes.
I'm sure that's all what I can say for now. And for the treatment and management of diabetes, mostly diabetes type 2 is manageable. Yeah, that one they can give sulfonylureas, which is a drug that is responsible for insulin secretion. Okay, and sensitivity to the receptors as well. And also metformin, it can also be used, though they inhibit the production of glucose and increase the insulin receptor sensitivity.
Okay. Okay, Doc. Since you have said that diabetes type 1 cannot be treated, it cannot be managed, can you kindly give more information about how it can be managed, even talk about diabetes type 2?
Oh, okay. That's a brilliant question. So for diabetes type 1, okay, these they come as a result of first degree. If you have a relative, a blood relative that had diabetes type 1, actually you are at high risk of having it as well if you're in the same family.
Sure.
Same blood. Yes. So why do they say it's managed, not treated? Okay.
Sure.
The and this one is very simple, is that those, let me just give an like what is what is the age limit. So from age 1 to somewhere at 25 or 20, um you are at risk of having diabetes type 1. So if you didn't have diabetes from age 1 to 25 and you have it from maybe 30 to above, that is diabetes, more likely diabetes type 2. So what do I mean? What I mean is diabetes type 1, it occurs in the ages between the ages of maybe from 1 to whatever 25 of age. Okay.
Yes.
So these people automatically their pancreas, their beta cells, it's more like a progressive thingy. They're being distracted. So there is no way we're going to cut the pancreas, no, because of the same condition. We can only manage them because we can only manage them by giving them insulin, exogenous insulin or synthetic insulin, whereby they just depend on that insulin, whereby you just ingest, and then that insulin is one which is going to regulate the uptake of insulin from the bloodstream to the body cells. Okay.
Yeah.
So now, on the management is only insulin. Okay.
Yes.
And when they are tipped much into hypoglycemia, which is low glucose, due to the insulin, if they are taking it more frequently, because they can be triggered into hypoglycemia. Okay.
Yes.
So what will happen there is that they'll also be given a dextrose or article glucose. More like, yeah, there's a certain percentage they give.
Yes.
Okay. And for diabetes type 2, mostly they can improve because those are in the receptor that are sensitive. Okay, they are not responding. So what will happen is that they can improve with exercise, change of diet, and also insulin. Again, when you give insulin, also start reducing the dose as you go, so that those receptors, when they adapt and they become more sensitive, it can be treated. Okay. Just like that. Yes.
Alright.
Yeah. That's what I can say for now, and this other maybe we can do it another day. I'm so tired.
Right, Doc. Thank you very much, Doc. Have a good day.
Yeah, thank you.